Alrighty, that's on. Okay, let's get a little light in here. To right. That's perfect. Alrighty then. Good morning. My name is Tony. I am a substance abuse counselor for the Department of Mental Health here in Los Angeles, California. Today we're going to talk about substance medication-induced psychotic disorder, which is part of the schizophrenia spectrum within the Diagnostic Statistical Manual. And this particular disorder, I chose this disorder because as a substance abuse counselor, I see this type of disorder all the time. People come in talking about hallucinations, delusions, feeling little bugs crawling, seeing shadows that are coming, thinking their neighbors trying to kill them, thinking the cops are out to kill them. So that's why I chose this disorder. I wanted to expand my horizon also as a professional counselor and truly understand what the diagnostic criteria is for this disorder. So let's talk about the criteria. Okay, in order to be diagnosed with substance or medication-induced psychotic disorder, you need to have the presence of one or both of the following. The first one is hallucinations, delusions, evidence from history or because of physical examination or lab reports that tell you the person has been intoxicated with the substance. So the presence of a substance within the examination has to be there. And the involved substance that you're talking about or medication must have the capacity for the symptom to create the symptom. For example, the person says that they're seeing shadows or hearing voices, and the drug of choice is caffeine, right? A stimulant, legal stimulant. Well, that's probably not going to be substance-induced psychosis. But the person comes in and says, I've been strung out for 2 weeks on amphetamine, then yes, that's probably going to be a good case for substance-induced psychosis. The disturbance is not better explained by another psychotic disorder, and it's not substance or medication induced, which means take away the drug, 30 days removed from the drug or the medication, the person is still seeing shadows, still hearing voices, whether the voices are malevolent or benevolent. That's probably not substance-induced or medication-induced psychosis. It's probably another type of mental disorder, which you would go down the schizophrenia spectrum with an assessment and find out what the person is, what the symptoms are. Or another criteria is if the symptoms were present before intoxication. So if the person tells you, well, I've been seeing shadows and voices since I was like 12 years old. I've been hearing voices since I was 12. This a couple like arguing all the time in my head. That's and the person was never introduced to any type of substance at that time. So that's probably not. That's a clear indicator that it is not substance-induced psychosis. So now, what's my understanding of the diagnostic criteria? With a proper assessment and a look at the history, right, of the patient. So you have to look at their hereditary history and find out if there's any type of schizophrenia disorder in that particular instrument, which can be hereditary. So when you do that, you cancel out that particular domain. But you can only find that out with a proper assessment. That's why an assessment is key. Evidence-based treatment, you have to go with cognitive behavior therapy and the harm reduction model and the peer model, right? These are evidence-based treatments that work. And for a particular case for substance-induced psychotic disorder, you might want to explore antipsychotic medication, also explore medication for for treatment of the drug. If it's an opiate, you might want to do buprenorphine or naloxone, any other type of opiate, synthetic opiate, to deal with the withdrawals. A great question is, what do you treat first? Do you treat the mental disorder, or do you treat the substance abuse disorder first? Which one do you treat first? Well, the answer is you actually treat both simultaneously. A great rule of thumb is the person comes in intoxicated or withdrawing. First, you want to put them into detoxification. So that's one type of treatment. Detox. After detox could be 7 days, 14 days. Yeah, they can do sober living. Sober living could be like a 90-day period, right? After that, you reassess the patient. If the hallucinations and delusions are still present, then you have to get rid of the substance-induced psychotic disorder and reassess the patient for bipolar, anxiety, depression, any other type of mental disorder, or maybe even schizophrenia or schizoaffective. It all depends on that assessment. It's very important. Outpatient treatment is great. The person comes in 2 or 3 times a week. In the peer model, you want to promote self-help meetings. 12-step meetings are great. Also, non-12-step meetings are great. Cognitive behavioral therapy based meetings like Smart Recovery, that's a fantastic tool right there. And harm reduction model. So give them their medication, explain to them, give them the psychoeducation, the benefits of the medication. Do you want to reduce your positive symptoms? Yes. Do you want to reduce the hallucinations, the voices? You want to go back to work? Yes, I do. Yeah, all these things. You want to be a productive member of society? The answer is yes. Then we need to explore all the routes of treatment. How has researching this particular topic enhanced my own personal and professional journey? Well, let me tell you, before this project, okay, I was totally convinced that we only had substance abuse and peer model. Also harm reduction, which includes a medication and treatment. But I never imagined that this particular disorder could fall under schizophrenia spectrum. So that's how my understanding has, my horizon has, expanded. Because now I can look at the DSM-5, go under that particular criteria, and find out, you know what, this person is not just high right now, or they're not just coming down from a substance, or the damage from the long-term use of this particular substance is causing this symptom. No, I can actually say, you know what, this person has substance-induced, medication-induced psychotic disorder, schizoaffective disorder, schizophrenia, bipolar 2, anxiety, depression, all these disorders that exist within the Diagnostic Statistical Manual, which before now I was unaware. I wasn't very educated on those disorders. I never needed to find out. I only focused on the harm reduction. As a substance abuse counselor, my scope of practice is it's very specialized, and it's like right here in a bubble. So now the bubble has burst, and I'm here to tell you that there's a whole world out there. As far as understanding psychotic disorders, understanding the different types of treatment available, understanding how important it is to not only educate the client, but the family, the partner, the circle, their support system, educate them that this person needs that type of treatment for life. It is a lifelong treatment. So as far as the treatment, cognitive behavioral therapy, the therapist will be able to assist with engagement, assessment, identification of negative beliefs, normalization, collaboration, analysis of symptoms, development of alternative explanations. So, for example, if the person says, I hear voices, alternate explanations would be, if you hear voices, why is it that no one else can hear the voices? So giving the person alternative explanations for the symptoms. So with that being said, I hope you enjoyed my video presentation on substance medication-induced psychotic disorder. I do understand I only talked about mostly the substance. Some medication can actually induce psychotic disorder. That medication can be like anxiety medication, depression medication, even some type of brain medication has been, has been proven to cause psychotic disorder. So it all depends on the individual, how the individual reacts to the medication, and the assessment is key. Assessment and reassessment is key. Thank you for allowing me the opportunity to be of service. I enjoy this project. I enjoy this class. Dr. Faille is amazing, and I was challenged in this class. I enjoy this presentation very much. This is actually my home studio. I'm actually a drummer. I drum for 2 bands. That's actually my drum set, and I actually sleep here, right here on the floor. I put a mattress, and so you're welcome to my house. You're in my house right now, and this is where I live, and it's amazing. I love it. I get to do my homework here, and live my fantasy here, and reality, fantasy coming together. Fantastic. I love it. Thank you for watching this video. I hope you have a wonderful day. It's been a pleasure being in this course. It's been very challenging, and I've learned so much, and I look forward to many more opportunities to be of service. All right, I think that's my time. Thank you for watching, and remember, if you're not sure about a substance and it's illegal, don't try it. There you go. There could be a severe consequence like addiction, overdose. All right, thank you for watching. Bye.